There is at the moment an excellent treatment. There are basically two types of treatments. One is desmopressin, which is a synthetic drug, which was discovered by us in the 70s, and it does release factor VIII of von Willebrand factor, which are deficient in von Willebrand disease, from the autologous stores. So it's free from any risk, is very inexpensive, but it has some limits in that it doesn't work in the more severe cases of von Willebrand disease. Then there are the plasma-derived factor VIII von Willebrand factor concentrates that's started about 40 years ago. So they have a long record of safety and efficacy. The limits are mainly that they are missing some part of the von Willebrand factor molecule, which creates some problem in peculiar situation, like in the situation of GI bleeding due to telangiectasia. But altogether, these are state-of-the-art therapy with a strong record of safety and efficacy. As I told you, von Willebrand disease enjoys an excellent treatment, but this notwithstanding, there is some progress. And the progress is that of replacing only von Willebrand factor. First, with plasma-derived product, which was developed in France. I was part of the development. And now with the recombinant von Willebrand factor, which is licensed in Europe and the United States. I'll speak first of the first and then of the second. First of all, the rationale. As I told you, in von Willebrand disease, there is a dual hemostatic defect, factor VIII of von Willebrand factor. You must replace both. But by giving von Willebrand factor, you trigger the production, the endogenous production of factor VIII. So the idea is to give the protein that is missing, which of course leads to the production, also the other one, which is missing only in a secondary way, that is due to the deficiency of von Willebrand factor. And the first study done in France or in Europe, but with a French product, plasma-derived, was the proof of concept, because it did show that this concept that I mentioned, the fact that by giving von Willebrand factor you also get an increase of factor VIII, was a fact indeed. As a matter of fact, there were several cases, including challenging situations like surgery, that were this drug was proven to be effective. But despite the availability of this product in some European countries, but not in the United States, a company chose to produce von Willebrand factor by recombinant DNA technology. And this is a monument of ingenuity, because this is a huge protein, the largest and one of the most complex proteins present in human plasma. So I think it was fantastic that they managed to make it commercially available. It is now licensed in the States and also in Europe by EMA and FDA. And again, it is very useful because at variance with the other products, there's really an intact structure of von Willebrand factor. With the plasma-derived products, for reason due to the process of manufacturing, some part of von Willebrand factor molecule are missing, which is not the case, they're not the problem in the majority of the situation. But in some critical bleeding episode, it may create some problem. And an epitome of this typical bleeding episode is GI bleeding, gastrointestinal bleeding, which occurs particularly in older patients with von Willebrand disease. Is very difficult to control. You need, with the traditional therapy, you need very long treatment, and sometimes it's not effective. And also there are problems to use prophylaxis in this patient. So I think that this product is really a step forward in that it contains really an intact structure of von Willebrand factor, And I can envisage that besides being useful in all the regular situation, common situation, it may be particularly useful in GA, gastrointestinal bleed, due to the formation of telangiectasia. Telangiectasia are dilatation of the vessel, of the mucosa, and of course these dilated vessels are more likely to bleed, liable and likely to bleed. So that's why I think that this product may represent an advance. However, at the moment, this is only speculative, and I think that a specific study should be done, or at least a large registry should collect these cases. I think this is ongoing, including in our center, but also in other countries and other centers.